latest webinar from Medicus IT. You are joining today Beyond the Doctor, How Patient Experience is Enhanced by Technology. In this webinar today, I'm very excited. We have brought together 4 industry experts to discuss healthcare's changing landscape and what it really means to be on the human side of technology, beyond the doctor, how we know when it's working and how we know when it's not. So whether we're talking about a CHC or a private practice, workflows are impacted and employee and patient roles are constantly being redefined as expectations of both are changing due to a fundamental shift on the delivery of healthcare services. So our industry experts today are going to help walk us through this important conversation. First, I am excited to introduce Kevin. Kevin is an inspirational speaker, author, and a former cardiac ICU patient himself. He's also a husband, father, and papa. But mostly, he has really lived and documented his inspirational story of a profound transformation to living life 2.0. That's what his book is called, Life 2.0, a journey from near death to new life. And his journey, including his unusual set of circumstances that led to his extended and enhanced life, has been shared in many different media outlets. So although he's not a medical expert, he has often been referred to as an expert patient, and he articulates his perspectives and observations in ways that oftentimes healthcare providers don't. So we're very excited to hear his insights here. Our next speaker today is Steve Rhodes, and Steve Rhodes is co-founder and co-CEO of Eero Health. He is a 30-year veteran in the healthcare industry, and he's very passionate about providing innovative solutions to healthcare industry that improve efficiencies in how healthcare is delivered, but also to drive a better patient experience and outcome. So his company and Steve have been a driving force in the adoption of electronic health records by providing turnkey consulting services to hospitals, IPAs, ACOs, and small to mid-sized practices for the last 18 years. Our next speaker is Charles, and Charles is the CIO for Shasta Community Health Center. Charles joined Shasta Community Health Center in 2006, and he's been the CIO for over 12 years. He has extensive background in education, specializing in technology and humanities. He's an active member of the HIMSS and CHIME. He's presented many topics related to healthcare IT to many other executives and industry experts, and we are very excited to hear his experience from actually being in charge of a CHC. And then finally, but definitely not least, we have Tim Hubert. Tim is the Chief Revenue Officer for Medicus IT. He is he is an entrepreneurial, an innovator, and an adventurer. He's been a business owner for over 2 decades. He's run the IT services for a huge $160 million, 260 plus employee organization called Atreon. He founded Trilix, a business consulting and application firm, and he just released a book on leadership called The Intentional Leader. So we have a very diverse group of speakers, as you can see here. I'm very excited to get this conversation started. As a reminder, it is being recorded, so afterwards you can share this with any colleagues, and we will have time for Q&A at the end. So any questions that come up, please feel free to enter them in the Q&A, and we will get to as many as we can. So I think with that being said, I think, Tim, the floor is yours until you're ready for our first poll.
Perfect. Well, thank you, Rissa. I just want to thank our panelists for being here and joining us on this very important topic. You know, in the industry that we're in, healthcare or in IT, there are usually words that come out that have big meanings. You know, 15 years ago, the word cloud first came out and it meant everything under the sun. It was hard to define, hard to put your finger on it. And I think patient experience is one of those big words that is our industry and that convergence of healthcare and IT. So what I'd like to do is take a few seconds now, Risa, if you don't mind pulling up a poll so we can just gather a little information from our team that's with us today. So we take a few seconds to go through and do this.
Yes, so you guys should see the poll up right now. Do you see it?
Yes.
Okay. Oh, shoot, hold on. Let me finish this 1 second. I think it is not allowing you to. Okay. If you could keep going, give me one moment for some technical difficulties.
No worries. Technology is great, but it doesn't always work the way we want it to. So what I want to do is I want to start with this concept of perspective. What does it take to really be able to drive changes in the healthcare industry to create a new and unique patient experience? And I believe the first step in doing this is changing the perspective. And as we talk about changing perspective, it really comes down to three key things I look at. The first thing I think that's happened in the industry is that for so long, we talk about patient experience. We put a lot of the onus on the doctors themselves, trying to get doctors to change and transform the way they deliver services to create a better patient experience. But fundamentally, I believe that we need to change the perception or perspective of how we do this and focus more on the support structure that's built around the doctors and the practice and the healthcare centers to be able to deliver the patient experience that we want. The second thing that I think we really want to do is that we really kind of have to understand that what are the expectations of the patient is. I think if we look at the online world and what we've seen in the online world over the last 20, 25 years, our expectations have changed as consumers, whether consumers of purchasing books or items off Amazon or purchasing and consuming healthcare solutions, right? People are so accustomed today, the one-click purchase and, 2 hours later, a product shows up at your house. They're starting to expect the same thing in the healthcare industry. And the third thing that I think is really important is that we have to change our perspectives as organizations. We really, truly want to deliver a new patient experience. It starts with us starting at the top of the organization, defining our North Star, defining what the patient experience needs to look like, what the purpose, what the vision, what the values are, the models, the methodologies we want to deliver that patient experience. So it looks like you're back, Rissa, so maybe we can jump in and do the poll again.
Yes, please.
Much better now.
Nothing like technical difficulties on a technical webinar here, but thank you for giving me an extra moment. So this is our poll for you all. We would love if you could help answer these questions. So on a scale of 1 to 5, do you think your organization is doing enough to create the ultimate patient experience? And this is anonymous, so don't worry, you can be honest here. Question number 2, are you leveraging technology currently? I would assume everyone is, but you never know. Number 3, how important are technology goals for your organization? I guess Charles won't take this personally as a CIO. And how did you find out about this webinar? Sorry, this is a sneak question for me, so I can help make sure that we get it in front of the right people in the future. And then lastly, who are you? Just so we can make sure that we're speaking your language and that we are supporting you for this webinar. So anyone else want to partake in this webinar? I'll give you 10 more seconds to get your answers in here. A little elevator music. All right, I'm going to end the poll. Some people are being shy, but we still have some good results. Can you see them, Tim?
Yes, I can. So let's go to focus on the first one for right now. The first one was basically, do you think your organization is doing enough to create the ultimate patient experience? And what we're seeing is that predominantly the most responses here are there's room for improvement. There's a few that are not sure, relatively neutral. From this, what we can tell just from the people in this audience, that there is definitely room for improvement. For the most part, some people think they're doing a decent job, but there's still a lot of room to change that experience. So what I like to do is kind of start in with the kind of the Q&A question with our team here. I'd like to direct the first question that I'd like to discuss for a few seconds is to Kevin. Kevin and I have known each other for about 15 years. We've been deeply entrenched in the technology industry, helping businesses transform the way they do business and conduct business. And Kevin, we've got ourselves reacquainted with that kind of from a new perspective. It's no longer around technology, but it's more around the patient experience. When we first talked, when we were putting this webinar together, I had read an article that you talked about the patient experience and what needs to be done to change that. Can you kind of share with the group here a little bit, what put you on this journey to focus from technology to patient experience?
That's a good question. Thanks. So for me, my journey began that I was in a situation where on a whim, I found out that I was on a very near term highly probable fatal cardiac event that could have happened at any moment. So all of a sudden, I'm rushed into the healthcare system. They perform this major surgery on me. I live. And what began to happen is I started to observe all of the little things that a number of selfless, caring individuals are doing, not just the doctors and the nurses, but the lab technicians, the food service people, the janitorial services. I mean, I was amazed at what happened. And it occurred to me that what was going on is that my value and relevance and importance as a human being was being highly affirmed. And it caused me to want to give back. It caused me to start a twice-a-day cardio exercise program, take my meds, eat right, work on my stress, et cetera. And I really wanted to demonstrate to healthcare what they do, why they matter, and the difference they make. So I started on this track of writing articles. I've been doing speaking, and that's what caused it. And what I talk about is, what does great patient experience look like, or how is it achieved from the perspective of the patient?
That's awesome. Well, first of all, I'm glad that you were rushed to the hospital and you got it taken care of, or you wouldn't be here with us today. So I'm glad you followed the care package that you got put together well. So I'd like to get into the real first question about this, building off what you said. You know, obviously we're here to talk about the patient experience. I just kind of like to get a kind of idea where we see how important the patient experience is for the future of healthcare. Right now, we have a pretty decent healthcare system. We're talking about improving this. How important is it, and why is that? So, Charles, you're knee deep in this every day. You're dealing with this. You're probably talking about this 3, 4, 5, 10 times a day. Kind of, how would you kind of start this conversation?
Well, thanks for the question, Tim. I don't think we have a great healthcare system, by the way. I think not for many people. One caveat is I want the audience to know that I do work in the safety net. Many of our patients it's an outpatient facility, and we serve folks that are underserved. There's a lot of forces at work that are putting more and more focus on the patient. I think there's a shift from a top-down delivery system where folks simply receive their care. There's a movement afoot for people to actually claim their healthcare. I think technology plays a role in that for them to become more involved in their care and raise their health literacy. The expansion of the Affordable Care Act, at least in the safety net, has made this more competitive than it's ever been. And so if you don't take care of your patients, they can vote with their feet and find some place to go that's doing it a little bit better. So you can't take anything for granted any longer. You really do have to focus on their experience. Finally, I think you have to meet the patients where they are. They're going to have different standards for what they determine to be excellent care. Some people want to be seen. They don't want anybody to waste their time. There's other people that are going to need that TLC that was mentioned earlier. So,
Charles, just a quick follow-up to that. You said meet the patient where they're at. Do you believe that patient where they're at changes based upon what's needed? If a regular routine checkup or follow-up, maybe their expectations are different versus dealing with something like Kevin went through. Do you think that changes depending on the circumstance?
Well, absolutely. No question about it. I think, when we look at our texting campaigns and things like that, where we're doing outreach for population health and whatnot, there's a certain demographic that's engaging, statistically more than others. These are folks that are otherwise relatively healthy. A lot of their care can be managed remotely. They don't necessarily need to be seen by a provider. They could be seen by a support staff to get them tucked in. Conversely, you have other folks that are managing a lot of comorbid conditions, and that can be really scary. And coming into the health center and having that personal connection is important to them. It's important to their treatment process.
Excellent. Steve, just kind of follow up with this. I mean, obviously, as this healthcare system is evolving, technology is playing a key role. I think a lot of us remember, 10, 15 years ago before the ACA, there were still a lot of practices and doctor offices out there that didn't have electronic medical records and systems. So how do you see that changing now and going forward?
Well, that's a good question, Tim. The industry is obviously changing overnight with COVID. I read a quote from the professor of medicine up in San Francisco and said, we changed 20 years in 20 days with the telemedicine emphasis. So what we're seeing is a big push towards technology, and it's driven off of not only things like COVID, but obviously we've got employment challenges in the healthcare space. We've got payer mechanisms that are competing with our interests, and we've got to be able to leverage technology to take out some redundant tasks in healthcare, but we can't miss that human element and human touch when it comes to patient experience. So when you look at how you're going to adopt, say, a patient engagement technology to hopefully improve the patient experience, you really have to look at your patients and understand where they are in their technology acumen. I mean, today, and I think Charles mentioned it, 20% of the US families don't have internet at home. So we have to understand our audience before we launch into these programs. So I always encourage clinics as they start to look at chronic care management, online scheduling, online bill pay, remote patient management as some of the more popular technology options out there to really improve that experience. Is understand your customers, look at your specialty, and as Charles said, meet them where they need to be. If it's somewhat of an annual visit, a checkup, things like that can be managed through some online presence. But as you mentioned, if they're chronic disease patients, as a lot of our senior citizens are, they're going to need more interaction, and a human element is so important. So understand your patient is the first place I would start.
Yeah. So it's interesting. I hit that age where your body doesn't work quite as well as it did when you were much younger. And so I threw my back out a week ago Monday, and I've been having issues with this. So I've been trying to get into healthcare systems, and I've had two experiences. One is I called into my general practitioner, trying to get an appointment. I stood on hold for probably about 5 to 10 minutes, got dropped to a voicemail, left a voicemail message. Next morning, I get a phone call to kind of set up a meeting to go see my doctor. So I saw my doctor. I had to go to another person, and basically I went online, hit the scheduling routine. They basically gave me a window of time to do. I got a text message confirming it. And then, like 15, 20 minutes later, I got a phone call from that office confirming the call. Two different experiences. Offices are literally, 10 miles apart, and just a wholly different experience. Do you see that this kind of more self-serve kind of patients doing things more on their own kind of as something that's changing with this industry?
I think you're going to see a lot more adoption of that, again, based on the conditions you're managing. You look at the influx of capital into the healthcare technology space and the players, whether it's Google, Amazon, Microsoft, whether it's CVS buying Aetna, you're seeing a move towards technology driving healthcare decisions. At minimum, technology companies are understanding the consumerization of healthcare, and that the patient wants more access to their provider. Yeah. I mean, if you're a parent and you've got children, you want to be able to get online with your pediatrician. You want to be able to go back and forth, because to take a young child into a pediatric office is very difficult. So a lot of specialties and a lot of practices are somewhere in the middle of that adoption. And I always encourage practices I work with. Patient satisfaction and patient experience are two different things. And you need to understand that, because you can have an experience that was bad, but still be satisfied that the result came out okay. If I went into the urgent care, I had an issue, I was all of a sudden treated, and that was resolved. My satisfaction is good, but the experience could have been poor that I sat in a waiting room forever. So again, we just got to understand that.
Yeah, no, I've sat in a waiting room with a broken wrist for 8 hours, so I know exactly what that feels like. No pain meds, no nothing. So, but you're ready to kill yourself at the end of the time, or kill someone. One of the two things are going to happen. There's a couple of points that you hit that I really want to kind of go back and explore a little bit. So the first thing you mentioned, if you're a parent and your child's being treated, how you want more access to the pediatrician or to the information that's available. I think, Kevin, when you and I were talking once, we were talking about it's not just a patient experience anymore, right? It's the patient, their family, their surrounding infrastructure that's really key. So could you comment on that just a little bit?
Let me start by saying, back to the original question about how important is patient experience. From my perspective, I think it's vital to the success of healthcare, and here's why. I think it's the best way to ensure high rates of patient return and net new patients, right? Patients, for the most part, have a choice on how they're going to get their care and who they're going to get it from. So if I'm not treated well by organization A, but I'm treated very well by organization B, I'm going to tend to go to organization B. So the experience is going to drive the success or failure of a healthcare organization, in my opinion. That experience goes well beyond the patient, and it goes well beyond the confines of the facility. So it goes into the family. I tell a story about how a chief nursing officer was asking a patient one day, "How you doing?" "Oh, we're doing great." "How are we treating you?" "Oh, we're doing great." And in the back of the room comes the voice of the daughter saying, "Oh, come on, mom, to tell the truth. You're not doing well. They're not treating you well." And so the family actually has an opinion on the care of the individual that can sway the individual's experience. So it's vital.
That's awesome. And so I'll go back to kind of a comment that you said, Steve, as well, that builds on what Kevin was just talking about. So you talked about there's a difference between patient satisfaction and the patient experience. You know, Charles, I saw you shaking your head very, very vibrantly when we said that. So kind of why did that resonate with you so much?
Oh, because it's true. They are different things. I think, in this country, our existing system, we're all pro at disease management. You get sick, things get bad. We have a system that is probably going to save your life. But we don't really celebrate the preventive model. We don't celebrate wellness, really, to the extent that we possibly should. We don't invest in it the way other countries do that outperform us year after year after year. I work in the primary care space. We do have specialty care. We're thankful for it. But in a lot of the areas that we serve that are rural and frontier, it's really, really difficult. And the way through it is health literacy and patient engagement and celebrating the preventive model. You do that right, the whole thing becomes cheaper and your communities become healthier. So I think, you ask different patients about their experience. If they came in, they were paid attention to, everybody was polite, and their issue was taken care of, fine. What if they had 3 or 4 underlying issues that went unaddressed? You're just churning at that point, and they'll be back, and you can do the customer service piece well, but there's more to it than that.
Yeah, it's a much bigger problem to solve than just making sure the client's satisfied or the patient satisfied. So I want to just shift the gears just for a second and kind of talk about what I think is the second big driver that we need to look at as we're trying to really think about the patient experience. And we talked about this in the first webinar we did back in the beginning of the year. And we talked about there are a number of drivers that are changing the healthcare industry specifically. The first one we talked about is that there's a change happening within kind of the market itself. The patients, the families of the patient, the pay systems, the providers, the market's changing at a rapid rate. And what we're finding is the changes to these drivers, where they may have changed over time, 5 or 6 years, you get 1 or 2 changes that are happening. We're finding it's now changing in weeks and months. And we saw that during COVID. I think that this comment you said, in 20 days, we did more changing than we did in 20 years, right? And I think that's a fact of life today. Our ability to respond to these changes are really important. So when I think about this, it's really kind of what I call minding the gap, is that we have to have a thought on what the drivers are, what the patients are expecting, for example. We need to make sure that we identify those drivers and we prioritize them, we put focus on them. The second thing that I look at is that we have to get more proactive and actually anticipate when these drivers are going to change, instead of waiting for them to change and taking time to do this. And what happens when we do that, if you look at this graph, the blue or teal line represents the rate of change that's happening within the industry. And as we're slow to respond to those or identify those changes, that orange line represents where any particular practice or healthcare center would be at any point in time. And you can see there's a gap that starts to creep between them, and there's a misalignment. With the technologies available today, no one should ever have to wait on hold for 5 or 10 minutes not talking to a person. There's technology that can solve that problem in minutes and create just a better experience. And then what I think happens is that we have to look at deploying technology that can bridge this gap, pull that gap, closer together so we're not misaligned with that. So when we talk about this and we think about how that gap may get bigger or smaller and how we can control that, what I want to focus on, and Charles, we'll start with you on this one, is kind of what's working. What have you seen working to actually close this gap and create better experiences and better outcomes for our patients?
Well, one of the prime directives that I have as a CIO here at Shasta is to try, to the best of my ability, to remove as much noise from the acute care visit. Again, I work in the FQHC space, and so a lot of what we do here is dictated to us. A lot of it makes sense. A lot of it we're given decent tools to use. I'm talking of things like screening tools, assessments, and whatnot. Every year they seem to be adding more, and they never take any away. Well, the end result of that is that your acute care visit is really just data gathering. You can't really process the answers to these questions in real time because all the time is being taken up just getting the information. So one of the things that we've done is we've leveraged our patient portal and created a lot of the forms where we can, where risk is managed appropriately, et cetera. But what we do is we query the system for everybody that's got an appointment the following week, and we pump out a lot of this stuff to them in advance. So they can sign consent forms, they can sign their notice of privacy practices, they can fill out a PHQ-2, they can do a staying healthy assessment. So all that information, they're helping us, right? So they're entering the data, staff is not. And so once it's there, then as part of our planning process, our pre-visit planning, we can take a look at what their answers were and focus on some areas of risk if we can. And so that helps in a number of ways. We're also on the hook for several QI metrics that have to do with the preventive model. To the extent we can front load that using technology, we're all the better for it.
That's awesome. Well, yeah, I know when I mentioned I broke my wrist. I broke my wrist. I went to an orthopedic surgeon, and so I was about ready to get my cast off, and I had to go in and I had to fill out all the forms. There are 4 pages of forms, things I had to sign to say that, HIPAA and all that kind of stuff. I acknowledge that. And literally go in there, have the conversation. So they'd say, once the cast comes off, you have to go to physical therapy. I literally walked out of the doctor's office, walked across the lobby to another facility that did physical therapy that had the exact same name, only physical therapy after it. And they gave me the same exact forms to fill out again. It's like, it's like craziness. You think if I filled them out once or I filled them out at home, I could have, avoided all that kind of time. It would have been a little bit easier because, writing with the cast on wasn't all that easy. So kind of building on that, Steve, when we think about this and we're making these shifts and we have things that are changing, obviously you guys are helping companies, putting technology and workflows and systems that automate this. What do you think changed in the last 2 years? I mean, there's a lot of rapid changing things moving. What did you see happening that was good with, adoption of technology to create better patient experiences?
Well, as I mentioned earlier, obviously the pandemic was a big influence on where care could be delivered. People were not able, in particular in elective procedures, to go get procedures. People were cautious about the healthcare system. They thought, they could be exposed in that environment. So folks started becoming much more consumer friendly. Just like someone mentioned, we were forced to shop online. We were forced to educate our children online. So now we said, why can't we do more healthcare online? So a significant amount of individuals that had never tried telemedicine, vice versa, practices that never implemented telemedicine, implemented it. Statistically, though, it was driven off of existing patients. It wasn't very heavy on net new patients. So you had a relationship there. It was also very heavy on behavioral health. I think in 2019, 1% of Medicare Part B visits were telemedicine. By spring of 2020, it's 13-14%. So that was a big driver. As we mentioned too, the downside of the pandemic, among everything else, was the reduction in the labor force. So practices had to be able to fill redundant tasks and automate tasks And that's where technology started to really creep in. Things they may not have used in the past, they had to use. Charles pointed out, and Charles is a thought leader in this environment, the patient is the one who has all that subjective data on themselves or whoever is being cared for. Why not push that back to them to complete it? Why should we have a staff member regurgitate it down? Let's everybody work at their pay scale, we always say to clinics. So that really helps the automation of that. And whether it's on a portal, on a smartphone, on a kiosk, I mean, we can all check in the Southwest online. Yeah. We should be able to do this in healthcare. So those were the real driving factors. Now, I would argue it's gotten more confusing these days because there's been hundreds of digital health companies coming into the market, and your practices and your healthcare systems are probably a little overwhelmed with choices. So again, I go back to understanding your patient, and then, as Charles said, understanding what we can be doing from patient experience. And it's that primary care, medication refill, check-in type of situation that doesn't necessarily need a face-to-face visit. That's where we begin, and we grow from there.
Yeah, I like that. My business that we talked about during the intro was known well in the industry, not only being a technical organization, but providing what we call the ultimate client experience. It was focused on customer service. And what we realized as we were going through our 20+ year journey of building that organization was you had to design it. You had to have a vision of where you wanted to be. You had to design the experience. And I had one very smart thought leader that came to me once, and I was complaining about things weren't working as well as I wanted it to. He says, it's working exactly the way you designed it, right? So the healthcare industry, what we get today for that experience is exactly what's been designed in. We can change that design at any point in time. So I like where we're going with this. I'm going to kind of go to the next kind of areas about adoption and talk about what adoption kind of means. And I think you hit upon this, right? If we focus on the client first, it's less about the technology, because there's 1,000 vendors out there that want to sell you new technology that's going to change your business. All that technology may be great, but it may not work for your customers, right? You have to find where your customers are, the needs of Charles's clients, where he's located, how he's serving them may be different than downtown Boston, right? So you got to look at where you're at, how you do that. So understanding that. So I focus on this is I think it's really about more the adoption. How do we get people to use the technology that we're implementing, both on our staff, both in our patient experience, our patient world as well. And so the first thing I think that falls in here, it's not doing technology for technology's sake, right? What is it, the problem you're trying to do? What are you trying to design? How is that going to improve the patient experience, and how will we eventually get the outcomes we want? Then the next thing we want to look at is kind of, how do you increase the usage of that technology you put in? How do I get more people to fill out their forms online and, check their lab results, all those kind of things. Then the next thing I think is about how do we create an integrated, experience? So we integrate the virtual, the physical experience. So it's one seamless exchange that's occurring. So those are kind of the areas that I kind of look at when I think about adoption. So I got two questions I'd like to explore here. The first one is, so if we do this, and we build this, the system, and we, focus on patient experience, we do it from the top down, everything we talked about, how do you measure the success of that? So Charles, you're probably being paid. You told me you've been a CIO for 12 years, so obviously you're doing some things right. You're being paid to do this. How do you measure the success of the stuff that you're doing?
Well, there's always the qualitative approach where you can pay attention to your surveys and all of that type of stuff. But us personally, Shasta Community Health Center, it's all about outcomes. Okay. We are on the hook from our managed care plan. We have a COES model here in Shasta County. So we have the luxury of just having a single Medi-Cal managed care plan. And that's a luxury. And I never thought I'd sing the praises of an insurance company, but they're actually quite good. They're very collaborative. They're very inclusive. And they invite myself and plenty of other folks to get together and think hard about these things and what can work. So for portal adoption and things like that, we have metrics, and those get reported out through our QI structure every single month. We know how many patients are in the tent. We know how many forms have been filled out. We know how many interventions we've had. We do aggressive texting campaigns for different populations of patients. We know what the read rate is on those. Most of these tools have a lot of they have metrics, right, to figure out what your adoption rates are. And then you always follow that up when you see the patient. Ask them about their experience. Am I replying to you, fast enough? They'll always say no, but there's always, in terms of getting the staff to do it, that is a perennial challenge. Just mention really quickly, I volunteer and teach a couple of classes at the local organization that trains MAs for our community. And if you go ask them and say, why do you want to get into healthcare? Emailing patients is not high on the list. It's usually way down at the bottom. They care about people. They're interpersonal learners, all of them. That's how they roll. And so for many of them, you have to win the argument and convince them that you like helping people. This tool is going to help you help way more people than a phone call or a visit. So, one at a time. So try to make it work. And I think after you have those conversations, most staff become receptive to it.
Yeah. But like anything, right? Change takes time, right? It takes the consistency and being deliberate about what you're doing to be able to make it happen. If you're not having those conversations, the change in adoption is not going to happen fast enough. While you were talking, Charles, it made me think of a very interesting question. We spent a lot of time talking about the patient experience. I guess my question is, does the necessarily improving the patient experience improve patient outcomes? Is there a direct one-for-one correlation? So Steve, Kevin, what are some of your thoughts on that?
Kevin, I'll defer to you to start.
Yeah, well, I mean, I lived that myself. I actually had a horrible situation that due to the experience that I received in the healthcare organization, I recovered very well and recovered very quickly and very strong. That's not to say that all outcomes are going to be like mine. We strive to have them like that, but we can't. What I've learned in my own experiences and my own research is that patients and families respond very, very well to high quality care, and most importantly, an engaged staff. When I say engaged staff, I'm talking about engagement with everyone in the ability to deliver high quality care. And I think that when people are motivated and they respond well to this, just inherently, they're improved. Their outlook is greater. They feel like there's hope. They feel like they've got some confidence. And I absolutely think it all rests with an engaged staff that delivers a high quality of selfless care.
Excellent. Steve, you want to add anything? Charles, want to add anything to that?
I would agree with Kevin. I mean, the staff transition is so important. As we mentioned earlier, you can't lose the human element when we start to look at technology and patient engagement. But where we definitely see that experience and outcome, not only is it that they had a better experience, maybe they'll adhere to the treatment protocol better and have a better outcome. But as we start looking at technology, and I think Charles mentioned this, we're gathering data the whole time. And at the end of the day, that data is going to provide us with identifying gaps in care. And if we can identify those gaps in care and intervene proactively, then the outcome will be much better for that patient, in particular as we start looking at our senior citizen population. So that's really where I see the next level of that patient experience, patient satisfaction, is proactively looking at our clientele, our patients, our patient population, and being able, as Charles is doing, is saying, hey, I see some things in this history that looks like an episodic event that's down the road. How can I prevent that? That's really the holy grail.
Yeah, I love that. Charles, any final comment, thought on that?
Well, I think, the incentives need to be aligned properly. The FQHC world in California, we still have a PPS, kind of a fee for service type model, where we're tempted to just see as many people as we can, right? Because we have a financial incentive to do so. Where I work, we are preparing for alternative payment methodologies, which are a huge game changer for primary care and even specialty care, where, you really need to maximize your resources, and you got to treat the exam room like the holy of holies, and the only people that walk into that room absolutely need to walk into that room. And you need to, no freebies anymore. You really have to marshal your staff and your technology tools to reach as many people, frequent touches. Not everything has to go through the provider. You just have to hire competent people, have good standard operating procedures, and really empower staff to help patients without having to ask for permission to do so.
Yeah, and I love that. It's really about empowering our patients to, I think what someone was saying before, to take ownership of their own health, outcomes at the end of the day. So kind of ready to wrap this up. I'm just going to start by just, kind of sharing a story kind of about my experience with the healthcare system. A little bit more than a year ago, my wife was diagnosed with pancreatic cancer. And she went through a 6-week battle trying to do chemo and all that stuff to win that battle. And unfortunately, she didn't. One night on Wednesday night, she was rushed to the emergency room, and through all their diagnostic support, they decided that she needed to be in hospice and that all treatments were going to stop. And we had, 4 to 6 weeks left to go. The next morning, I leave the hospital. Next morning, I go to the hospital to see my wife. I was told because of COVID protocols, and they had rules on who could see what visiting hours would be, that they were going to extend my hours. I pretty much had carte blanche access to go see my wife at any point in time. So I get to the hospital. It's probably the worst day of my life. And I go to the front desk to go see my wife. The computer systems were down. I sat in that lobby for 45 minutes while my wife's upstairs, been, put into hospice, just growing angrier and angrier and more frustrated with the whole situation. So we got to take, when we're thinking about the patient experiences, about that there is a human element that happens with every one of these. When some people are in the hospital, that's the last place on work in the world they want to be at that moment, right? And as we design these solutions, we got to consider that's what we have to make better, right? We have to make the experience for my wife who's being treated, who's going into hospice, going through this transition, we have to make that comfortable. We have to make for the people that are supporting her in that journey more possible. We can do this with technology. And it starts with the basics for making sure the equipment that we have in place today runs and it performs well. We can also change the nature of what we're doing. And I fundamentally believe if we start thinking about healthcare and how we deliver a patient experience, I believe that if we shift our perspective on that, we will get better outcomes for everyone involved in the process. I do think there's a lot changing from the way patients expect, what the payers are willing to do, what's happening around crisis situations like COVID and security and all those kind of things, that we have to be mindful of this and be able to adjust and be more agile in how we think about the solutions that we're putting in place. Then last but not least, it's not this, technology for the sake of technology. It's really putting in solutions that can be adopted easily, well, that are seamless, that allow our users, our patients, so no matter where they are, to be able to kind of connect with this and go from there. So with that said, I'd like to turn it back over to Rissa, who can help us with the Q&A and wrapping the meeting up.
Great. Thank you so much, Tim, Steve, Charles, and Kevin. We have a couple great questions ready for you,
Awesome.
but this is the time for everyone. If you have any questions, please pop them in the Q&A feature if you can, so we can make sure we can get to all of them. And then just before I get in the question and answer, I'd love to tell you guys about our next webinar on the next slide, which you can mark your calendars for and save the date. And it is called Mind the Gap, which I feel like I need to say with a better British accent when I say it. But this is all about keeping your healthcare technology decisions on course. So if you guys recognize some of these speakers, it is because you have seen them before. They were part of our first webinar, which got rave reviews, and we're bringing them back by popular demand to kind of take the conversations to the next level. So we're really looking forward to this. Please mark your calendars June 9th at 12:30 p.m. East Coast time or 9:30 a.m. Pacific time. And with that in mind, I will make all of these speakers a little bit bigger so you all can see them. All right, so let's get to these questions. Let's see. What is the predominant review authority? Is it Yelp or Google or others? And how can we get more online reviews?
Good question. So Charles, would you like to kind of take the first stab at that, because you're kind of in that wheelhouse?
Sure. I think that Google probably outpaces Yelp at this point. Yelp is a hardcore First Amendment advocate, so they let a lot of stuff on their site fly. And I think that a lot of times, going after them or going after the people that are posting for libel is really difficult. The accusations may or may not be true, but just because they're online, there's a lot of damage control and reputation management that needs to occur, which is unfortunate, but it is what it is. At the same token, with Google, I think you're kind of manufacturing a reputation in a lot of ways. We use both. We monitor our Yelp profile. We pay attention to Google. We do polling after every single visit. So our providers or our patients, have an opportunity to weigh in on what their experience was. We look hard at that data. We celebrate our victories. If somebody says something nice, we send that to the clinical team that saw that patient, so they see that almost immediately, which is really good. It's good for morale. Let's our beleaguered providers with limited staff know that they're actually making a difference. So that's good. But it's a big thing for healthcare. I think if you're not managing your online reputation, you're doing yourself a massive disservice. And responding directly to people when they have concerns or complaints, I think, is the best practice.
Charles, you made a great point of that. There's a lot of software tools that are coming out in the market now. I'm familiar with one that kind of focuses in the healthcare industry called Raider 8, that are reputation management solutions that help you with surveying, help you get more and more results. So that's going to be a big thing that you'll see happening and growing in this space specifically in the next few years. And I also think the other thing that you said, I really want to drive the point home too. If you're really trying to create a better patient experience, creating a closed loop system where there's a communication. It's not just a satisfaction survey you're expecting people to fill out, but taking the feedback, making changes, contacting the individuals, having more of a conversation really is a big part of that as well. Surveys alone doesn't solve that problem.
Absolutely. Okay, great question. So
Awesome.
here's another one. As far as focusing on wellness and preventative care, what is happening to improve this space, and how is technology taking a role?
Well, I think does somebody else want to take that one?
I was going to say, Kevin, I can take a quick stab. I think, as Charles indicated, the drive towards value-based care is really starting to happen. Adoption is obviously is not great right now, but we know the movement is there, and that is really towards wellness. If we can treat our patients where they want to be, our senior citizens, we can manage through remote patient monitoring, through chronic care management, multiple diseases, and again, medication adherence and things like that, then we're going to see the wellness opportunities really expand and improve. And the funding mechanisms are going to be key in driving this because, as Charles indicated, if you're in a throughput business where you get paid to actually see patients in your clinic versus paid to actually care for them, you've got to change those financial incentives. And I have the luxury of working across the country, and value-based care has a bigger presence in areas in Southern California, in markets in Florida and Texas versus, say, the Midwest. So what we're seeing is that mindset change towards wellness. And that is all about patient engagement. And it's all about the technology to interact with your patient when they're not in between the four walls of care. Kaiser does a good job with that model. And I think you're seeing a lot more organizations, that have the leadership, and have the guidance to start to embrace that.
Charles, what would you add to that?
Nothing. I think Steve did a really good job with it. We have what we call enabling services throughout my practice. And these are services to our patients that don't generate revenue typically, right? So we have cooking classes for diabetics. We have group visits that we're not compensated for. We're able to use our population health tools to reach out to folks that need some TLC, and we have adopted the Stanford model for diabetes education, where it's patient-led after a period of time. That's had some successes for us as well. But I think, paying attention to folks that are not compliant with the basic blocking and tackling of the preventive model, you do that well, a lot of things start to happen for you. Shasta County is if you look at the county health outcomes, they're posted every single year. We've seen some improvements since I've been here, so it doesn't happen overnight, but You know, we have folks, you know, passing away from colorectal cancer screening. That's a crime. You know, that's just a shame that such a slow growing preventive cancer can't be tackled, you know, and if you know about it early, you can handle it. But once it gets to the point where you're being admitted to a hospital, you got real problems. So those types of things, I think technology plays a role in identifying who they are. And then, you know, our teams know who they are. So if they plan their day properly, they can take care of those opportunities. And then technology through portal for depression screening, for example, you know, that doesn't have to go through the clinical team per se. So if you think about what on that list of preventive measures, what can you handle, right? That doesn't require the provider. You have to start thinking about that. It's a stark betrayal to the fee-for-service model, but you do have to do it.
You know, one of the things we've been talking and working with a lot of clients on is the whole chronic care management, right? There's so much of the chronic care management with our patients that can be automated, because a lot of it's reminders, following up, checking with client, you know, the patient, seeing where they're at with their diagnoses and, you know, how they're dealing with the prescription and treatment that they're getting. So we're seeing a lot of that as a big way technology is playing to help change that model today. And in some cases, actually helping create different revenue streams that are coming into the healthcare institutions.
Great. Okay, so here's a great question. This one's for Charles. With your patient population, are you seeing any trends or more requests for patients to be seen in a more flexible way? And what impact is telehealth having on that?
Absolutely, no question about it. I mean, the irony is that these tools were in place. We had them, you know, when COVID hit. We just had a really good reason to roll them out, and we did. You know? So I would just say that at our zenith, we had about 22% of our patients were being seen telehealth or video visits during the pandemic. In our behavioral health space, it's maintained a high percentage. There's a lot of reasons for that. I think that the nature of the visit bodes well for a video visit. As long as you can see the patient, you can read their body language and nonverbal cueing and those types of things. So it does lend itself well to that model. On the primary side and specialty care side, to a lesser extent. But remember, concurrently, we've seen record messages through our portal as we're a year into a new platform, and every month we have there's more forms being filled out, more messages being sent and answered. And the other ingredient there, frankly, is the staffing shortages, right? If we were properly staffed up, we'd be busy answering the phone instead of using portal, but we aren't. And so we use the tools that we have. And my center managers are starting to figure out that, using portal and having the video visits and things, that they're less resource intensive. The standard of care, it might be an argument that it's a little bit less than gold, but the patients are being seen, they're being taken care of. So that's what matters.
Yeah. I could argue that it's not less than desired. It's just different, right? And I think we have to learn new ways to provide treatment and care across a new format. The other thing that's interesting with this, Charles, I was going to follow up with you. I mean, obviously, the last 2 years has been challenging for everyone from, talent being in the office to talent in general. The great resignations going on and people are moving around. People are changing careers, like crazy. Has that been affecting you in your operations in a big way, or is it kind of, you're in the kind of Northern California, a little bit more rural area? Is it impactful there? Because I know in our areas, it's in the metropolitan areas, it's crazy.
Yeah, big time. I used to have a full head of hair, man.
Yeah, that was 2 years ago.
No, I think it's really tough, and it's tough on morale. When you have shortages and stuff, familiarity is, for the acute care visit, familiarity is the straw that stirs the drink. It always has. When you have a provider that's worked with an MA for a period of time, they can read each other's minds. They know the dance, right? We have scribes here. It's another member of the team that does a lot of the documentation. When you're short-staffed, you got to plug holes wherever you can. And so people are getting a different team every day, and that has its own stressors. And in the absence of having everything be standardized, that exacerbates things as well. So yeah, we're not, I think yesterday I checked and we still have upwards of 50 vacancies out of a 450 person staff. So significant gaps right now.
Yeah, that's what we're seeing with a lot of practices that we work with. And the hard part is that it's just hard to keep up when you're short one person, no less 10 or 50, whatever the number happens to be. And it just makes everything go slower than you want it to go at that point in time. So big challenge.
I can tell you one of the main services that we're being requested right now is to come into organizations, try to standardize workflows and build training materials around their technologies, because they're introducing so many new employees, they can't keep up.
Yep. Yeah. Yeah.
All right.
Training methods are going to change. That's for sure.
Yeah.
We have a couple more great questions, but I want to be respectful of everyone's time. So what I think we might do is we might ask our speakers if they could answer them, and then we'll send them out in our follow-up email and post them on LinkedIn. So please make sure you're following us on LinkedIn and you look for our emails. But I want to wrap up with just one final question. So Tim, we've heard a lot of great things today. This has been a great conversation. A lot of people are making comments, that they've appreciated it. So where do we start? Where does someone start?
That's a great question, because like I said in the beginning of this, I think patient experience is a big term that's used in a lot of different ways. And I don't think we fully understand the way it's going to be used. I think it really starts with kind of taking a step back a little bit when we're thinking about patient experience and really kind of looking at where our perspective is and shifting it to where it needs to be. I think you've heard Charles and Steve talk about meeting the patient where they're at. I think that requires us to rethink what the engagement with a client looks like. So changing that perspective is key. I also think once you understand the perspective of the key, players, the payers, the patients, all the pieces that are in place there, I think then coming up with a strategy to create what I call the North Star, kind of the vision, direction, mission, values, the models and methods you want to do things is really essential. If patient care and the patient experience is really your top focus, it affects everything you do and every decision that you make from the top down. It affects who you hire, who you bring into your organizations. I'm in the technology world heavily, and there's a lot of really great technologists, but they're awful with doing customer service. So you may change the way you hire. And so you're not hiring just based on technical skill anymore. So that North Star and creating that, understand what that perspective you want to go forward with is really, really important. Then everything is driven from there. So, awesome. Well,
Great.
thanks.
Well, thank you so much. Thank you again so much, Steve, Kevin, Charles, and Tim. This was a really great conversation. I hope everyone that tuned in got a lot out of it. And again, this webinar is recorded, so we'll be sending it out shortly in the next couple of days so that you can share it with any colleagues. We'll be answering a few more questions, so make sure to follow us on LinkedIn. And if you have any questions or if you would like to speak, about any of these topics for your practice or your CHC, please feel free to reach out. We can definitely connect you with any of our amazing speakers today, and we would love to help. So thank you again so much. Don't forget to save the date for our next webinar, and we hope you guys have a great rest of your day.
Thank you.
Awesome. Thank you, Risa.
Bye.
Thanks, everyone.